Okay, good morning. So it's 8 o'clock in the morning. Good morning, everyone, for joining us for the 10th lecture of the PAASE webinar series. So again, the webinars are being organized by the American Academy of Science and Engineering, which is an organization consisting of engineers and scientists of Filipino descent, initially based in the Philippines and in the US, but now we have expanded and we have members in other countries as well. So I am very pleased to welcome you all today for today's lecture. The lecture is entitled Policy Development for COVID-19 Pandemic Response Using System Dynamics. Our speaker is a very young professor. She is an associate professor and research fellow in the Department of Industrial Engineering of De La Salle University. She earned her bachelor's and master's degree in engineering from De La Salle University as well. Meanwhile, she obtained her PhD in Industrial and Systems Engineering from the National University of Singapore. Her research interests are on robust optimization, systems thinking, and their applications to energy networks, supply chains, and environmental systems. So, our main speaker today is Dr. Charlie C., but she will be joined by academician Alvin Kulaba, who is also a university fellow and a professor of mechanical engineering at the De La Salle University, Manila. And his expertise is on engineering systems modeling. Okay, Charlie, if you're ready, and Dr. Colaba, you may begin.
Okay, a pleasant day to everyone. Morning, probably in our part of the world here in Asia, and pleasant evening, probably in other parts of the world. Good morning, everyone. So today, let me begin about system dynamics, modeling. It is a work that I have done in the past, and now I'm back, having worked on modeling of, engineering systems, and SD certainly is one amongst, the models that I've worked on. Next, please. So I'll be, Charles, next slide, please. I'll quickly give you a brief background and history of system dynamics and its applications and some of its trends. So models basically is something that we apply to represent key concepts and the relationship between various types of variables that can help us understand how the system or process works or how it might work. Modeling is the process of describing the behavior of some real-life system or phenomenon. And in many cases, like myself, who has a background in engineering, we would represent the model with a mathematical description, and commonly, to most of us, this is known as the mathematical model. Is shown here, Charles, next slide. The problem, and a mathematical solution is arrived at, and these are interpreted to provide a real life solution, although models would in many ways unable to solve the problem directly. Next slide, please. What shows here are real world problem models and how they are actually performed, where background research and a more focused workable problem is done, where investigations and experiments, if appropriate, are undertaken. So it's a cyclic process of simplifying, trying to represent the problem, translating it, simulating it, and finally interpreting, to arrive at and solve the real world problem. Next slide, please. Here, I have taken quotes from J. Forrester. Next slide, Charles, please. According to J. Forrester, the image of the world around us, which we carry on our head, is just a model. Nobody in his head imagines all the world, government, or country. He has only selected concepts and relationships between them and uses those to represent the real system. Many of the problems the world faces today are the eventual result of short-term measures taken last century, according to Forrester. And J. Wright Forrester was a pioneering American computer engineer and systems scientist. A professor emeritus at MIT Sloan of Management, he introduced the Forrester effect, describing fluctuations in supply chains. He was credited as the father of system dynamics, which deals with the simulation of interactions between objects in dynamic systems. The concept was developed in the 50s and 60s at MIT, mostly applied to organizations and other social systems. Next slide, please. How this SD works, is based on ideas of feedback, similar to those in electrical and mechanical control systems, where Forrester based his, ideas from being, an electrical engineer, by background. Next slide, please. SD was developed also to evaluate how alternative policies affect growth, stability, fluctuation, and changing behavior in corporations, even cities and nations. So a simple sales model, is shown here. So you can see without intervention, potential customers run out, and maximum actual customers is reached. Sales will go down, assuming only one sale is made per customer. Next slide, please. SD is a modeling and simulation technique that allows us to understand how complex systems behave over time. It captures internal feedback loops and delays that affect the system's behavior and investigates information feedback characteristics and deals with time-dependent behavior of managed systems. Next slide, please. It also applies qualitative and quantitative modeling on how information feedback governs its behavior and allows robust information feedback structures and control policies to be designed through simulation and optimization. And these models are used also for policy analysis and design. The first known application was to a problem that General Electric had with their employment cycle back in the late 50s and 60s. So SD then was exclusively applied to business and managerial problems, as actually expanded in the book on industrial dynamics in 1961 by J. Forrester. And the next slide shows some of the publications in the journal where most of the SD models have been used for business and manufacturing problems. Next slide, please. In 1968, a collaboration between Collins and Forrester led to a book on urban dynamics, which applied SD to population, housing, employment, industry, economy, and others. Next slide, please. So since then, SD has been applied to other applications such as global sustainability and bioenergy systems. Last year, we tried to model the bioenergy systems for algal refineries, primarily for the production of biofuels. Next slide, please. As SD has also been applied to public health and epidemiology problems, which actually drives us to work on the current problem on COVID-19, pandemics. Next slide, please. And if you can see in the next slide, this is how the trend on system dynamics. You can see that in recent years, the SD has already shifted, from problems in health to now problems related to global sustainability, specifically for certain resources such as water or carbon emissions, and these are some of the applications we can relate to the current pandemic problem. And our DLSU SD team is shown here, and one of our members, Dr. Charlle C, will be presenting our recent work, which is shown in the next slide, which is an upcoming publication on the policy development for COVID-19 pandemic response. So that's about it for my part, and I'll now turn you into Dr. Charlle C. Charlle, please. Thank you.
Okay. So, good morning, everyone. Thank you again for joining us in this webinar. And thank you, Dr. Kulaba, for that introduction, and also for introducing the team. So as Dr. Kulaba mentioned, this is a work, a collaborative effort between the Mechanical and Industrial Engineering departments of De La Salle University. I'll now go into our work on COVID-19 using system dynamics. So basically, we evaluated policies that have been used to address COVID-19. But before that, I'll also give an introduction or an overview on the foundations behind this modeling framework. So let's say, for example, you're driving your car and you see that your tank is empty. So naturally, what you'll do is to go to the gas station and fill your tank. So this particular sequence of events is straightforward, and we understand the logic behind it, such that you're given the information triggers a certain set of actions, and the actions lead to a consequence or a result. Now, the information could also be associated with a problem, and then the actions would lead to a solution. Now, let's consider another scenario. Let's look at Manila traffic, right? So everyone is familiar with this, and for example, you're tasked to actually solve it. So let's take the perspective of the government. Through the years, we've seen different policies like the odd-even scheme, number coding, and recently we even had the bus lanes along EDSA. But what has happened from these actions? Yes, they led to a consequence, but a consequence that wasn't really intended, because supposedly these actions should have solved the problem. But what has happened? We're stuck in the same scenario, and some might even say that traffic has gotten worse through the years. So the story doesn't really end in this square, but actually we find ourselves continuously circling. And this is the main premise behind system dynamics. Things are not linear, events are not linear, but instead they're cyclical. Okay? They occur in circles. Why? Because in the ideal world, the problem should have led to an action, and the action should have produced a result that we wanted. Most often than not, the result actually creates future problems and actions. So what SD is telling us is that there really is no beginning or end to these events. Okay, again, it's cyclical. Okay, what makes matters harder would be the presence of these delays. Okay? For example, you're given the information and then you're bound to act on the information. But the problem is, these actions do not come instantaneously. There might be delays. So by the time you actually do the action, you might be solving a different problem altogether. Things might have already changed. Okay? In the same way that your actions would not produce immediate results or the consequence, these might come later in time. Like, let's go back to the traffic problem. The government probably didn't foresee that, doing these policies would lead people to actually just buy additional cars. So in effect, the policies led to additional cars on the road rather than a decrease on the cars on the road. Again, unintended consequences. So SD takes the perspective that you need to look at these loops, you need to look at these cycles in order for you to understand the problem. So take a step back, look at the bigger picture, and from there, you'll gain a better understanding on what is actually happening. Okay? So that's basically the foundation of SD. And in the language of SD, we call these feedback loops. Okay. SD recognizes that this world is a complex system composed of nested loops. When we say nested, we're not dealing with one loop, but an interconnection. And the interconnection actually represent the structure within which all changes could be understood. Okay, now let's slowly transition to disease outbreaks, since that's the main gist of this talk. First, I'll go through the sequence of a general disease outbreak. Actually, doesn't matter what type of outbreak you're dealing with, they follow this logical pattern. Okay, so you have your susceptible, and the susceptible leads to infections. So when we say susceptible, these are the people that could be infected. Okay, so the susceptible leads to infections. The infections would eventually lead to recoveries. So we call this the SIR progression. Now, how do we translate this sequence into the feedback loops that I was talking about? First, let's go from left to right. Okay, just follow the arrows. So from the susceptible, we have the new cases, and then the new cases builds up to your active cases. And eventually, the active cases would lead to the recoveries. These terminologies have become second nature to us because the DOH has been giving bulletins, and they're using the same terminologies, and it's actually what we use, okay, in general disease outbreaks. Now, how do we close the loop? We close the loop by moving from right to left. But before that, let me just introduce this positive and negative signs. So they represent polarities, because in system dynamics, it's also important to look at the direction of change. Like, for example, the more susceptible you have, then you can also expect more additional cases. You can take the analogy of India versus New Zealand. Obviously, we'll have more infections in India just because of the size of the population. So that's the general representation of your positive sign. Now, again, let's go from right to left. Right to left, you see the sign now is a negative one, because when you have more infections, in effect, you're actually shrinking, reducing the number of your susceptible. This because of the assumption that when you get infected, you gain antibodies and eventually be considered immune to be reinfected, to the reinfection. Okay? So going to the opposite end, so let's now look at the recoveries. In the same way, when you have more recoveries, you're actually reducing the number of active cases. Okay? So this is a typical feedback loop of a disease outbreak. And again, it could also be applied to the COVID-19 pandemic that we're seeing for a specific area. As Dr. Kulaba mentioned, SD is a modeling framework. So the goal here is to translate these loops into mathematical equations and eventually come up with simulations. But I won't go into the details of the actual model, but instead show you the result. Okay, because our ultimate goal is to have a projection, is to obtain a simulation of these variables. So this is our goal, is to generate the graphs that you see here. Okay, so let me explain in the first graph, I'm talking about this figure on the left. We see three variables, the behavior of three variables. The new cases will be represented by the blue graph, and then the green one will be the active cases, and the red one would be the deaths. So as you can see at the start, since no one's infected yet, So since no one's infected yet, we're at the zero, but then it goes through an exponential increase. And then it peaks, and then following that would be an exponential decrease. In the same way that your death, the death here would be a bit delayed. No, okay, let me start with the active cases. So your new cases will start, and then this will be followed by the active cases, because obviously there's a delay between recovery. And then the same way with death, it won't occur immediately. Eventually, what this graph is telling us is that a virus, no matter what the form is, would have a natural death. Eventually, the susceptible population will get depleted, and then the virus will just go away because no one could get infected anymore. The problem is we don't really know how high the peak is. Oh, by the way, we just use hypothetical data here. So the 10,000 and the 150,000 do not represent any actual value or any actual data. Okay. The problem, going back to the peaks, the problem is we don't know how high the peak would be. Is it 5 million? Is it 10 million? Wherein even the death here, we don't know how the number where it will peak. Wherein even like one death is already one death too many. So your ultimate goal here is to make sure that the peak is not that high, the exponential increase is not that fast. Okay? And if possible, you prevent that exponential increase. And then going to the figure on the right, it's actually comparing your susceptible versus your recovered, or versus the recoveries. At the start, everyone's susceptible to the virus. So it's at the maximum level, and your recoveries will be at the zero level. And through time, they will actually reverse course because now the infections are happening, your susceptible population is decreasing, your recoveries are also increasing. Now, as you can see, the goal here is to have a plateau. And this is what flattening of the curve literally means. We want the infections to go to zero so that your death will just be a flat line, your susceptible will be a flat line, the recoveries will be a flat line. So that's the actual representation of flattening of the curve. Now, this is what we expect to happen, and we can when we say that the virus is done. Let's look at what's happening in the Philippines. The figure on the left shows the actual cases. So I obtained this from Mr. Edson Guido. So he's the data analytics guy of ABS-CBN, and he keeps on monitoring, or he's actually plotting this, updating this every day based on the health bulletins of the DOH. And as you can see, our recoveries are still seeing an increase. Even if it's not exponential, it's still an increase. That means there's still infections that are happening. Okay? Our goal for the recovery is represented by this blue line, and we're far from it. The death, while the slope is not that as steep as the recovery, it's still not flattening. Okay? And even the new cases every day, we can't really say that it has stabilized. So we're far from this flattening of the curve that we keep on hearing, unfortunately. Okay, now, the SIR model is not new. It has been introduced by Grassley and Fraser back in 2008. Okay, but what the events in the last few months have shown us that we can't address this virus without looking at its interactions with the other sectors of society. Okay? We saw how it would impact the economy, the healthcare sector, the LGUs, and so on. And so this is what our team actually did. We integrated this SIR model and extended it to include the interactions that I just mentioned. again, not going into the nitty-gritty of the model. I'm just going to show you the high-level picture of what we did. The SIR model is at the center, and then we connected it to the economy, looking at what business stoppages, forced closures would have done, the impacts of that. We also looked at how the SIR model impacts the healthcare system. So the workload on the frontliners, how effective it is, and even the funds that would be generated or given by the government. Okay. So in this, we evaluated the impacts of various policy actions by the government. We wanted to look at the effectiveness of these policies. So basically, we chose one performance measures, and that is to look at how these policies affect the infection rates, the number of infected people in a population. Because for us, that represents the gravity of the pandemic. This model has been implemented in Vensim. This is a commercial software which is widely available. You can download it for free actually from vensim.com. So for those who are interested. And again, the manuscript is under review right now, as Dr. Kulaba mentioned. Now, let's look at some of the common responses and policies that have been done. So we're not limiting this to the Philippine setting. So the first two policies that I'll be introducing is something that has been adopted by different countries. The first one would be the increase in public health capacity. So we actually saw this from Wuhan in Italy. They constructed additional hospitals just for COVID-19. And even here in the Philippines, wherein we had additional quarantine centers. So some of the arenas, the World Trade Center, they were all converted to quarantine centers. The result of the simulation can be shown on the left. So the black line here, the solid line, represents what we call the baseline, the original behavior of your infected without any interventions. So without any policy, there's the expected behavior, and this is similar to what I showed earlier. The effect of the policy can be shown by the dashed lines. Okay, so let me just point out some of the things that was caused by this policy. First, there's a dip in the peak. Okay, you were able to lower the peak and even delay the onset of the exponential increase in cases. Why? If you increase your hospital capacity, if you increase the number of beds, then your COVID patients would be able to get the appropriate treatment that they need. If you can recall, during the earlier parts of the ECQ, a lot of the patients were just told to self-quarantine at home. And that runs the risk of actually creating more infections, right? These patients would in effect or probably infect their household. So with additional hospital beds, you're able to isolate this and decrease the contact. And that's the reason why there's a delay in the peak. However, it's not as substantial as we would have wanted. Why? Because if you maintain all the variables, if they're still behaving just like your original model, then your healthcare system will simply be overloaded. And that's the reason why there's still an exponential increase, granted that there's a delay. Now, let's look at another popular policy. We keep on hearing this from our healthcare officials. Maintain social distancing and even lockdowns. You know, the strict lockdowns that we saw from Wuhan, from Italy, from Spain, and even in Singapore, wherein they had their circuit breaker rules. Okay, so the assumption here, unfortunately, is that it has to be strictly implemented. That was the assumption that we used. And the reason why it's a popular policy or a popular thing that has been done all over the world is because science backs it up. Look at the simulation. From the original peak, this policy actually is able to bring down the peak significantly, and the exponential increase, the slope of that graph is significantly slowed. Okay, you're able to slow it down. That means you're able to control the virus. Okay, the number of cases that would be adding up every day would not be as fast as as your baseline scenario. Okay, now in other countries, this has been successfully implemented just because everyone stayed at home. For example, in Italy, the government gave everything that people needed such that they didn't even need to go out for essentials. And unfortunately, even if we had our ECQ, everyone or a lot of people were still going out. So the implementation was not as successful here. So now let's look at the Philippines. We started this work during the first phase of the ECQ. That was from March until April. And the main question then was, is it right to lift or should we extend? Okay, so we actually compared these two. The first graph that you're seeing here is to what if we have lifted the ECQ, meaning we ended the ECQ by April 15, I think. Okay, what happened? If this policy has been done, if we lifted ECQ, the peak would have been brought down again, but not substantially. And the delays, we can't even say that there's a delay in the infection because right after, okay, because the exponential increase actually occurs almost simultaneously to the original graph. That means lifting the ECQ would have immediately started the cases to increase again. So in that sense, we can say that the government did the right thing. Okay? Now let's look at another one. If we extended the ECQ, I think we looked at the extension for just one phase, extending it for another 2 weeks. If we extended the ECQ just for 2 weeks, this is the thing that would have happened. The graph on top. Okay? The peak actually looked the amplitude of the graph or the height actually just looks the same as lifting the ECQ. The only difference would be the significant delay of that peak. So I think we can say that this is the second wave that people were afraid of. If the government just extended it for 2 weeks, this is the result of the simulation. And the idea behind this is that the simulations actually show that you just run the risk of merely delaying the peak. So without significantly reducing the number of infections. Why? Because during the ECQ, you completely starve. Okay, that's a term that we can use, starve the virus for the duration of the lockdown because everyone's staying at home. However, this lengthens the amount of time it will take to recover from the virus because once you lift it, again, people go back to their old ways. And beyond a certain limit, extending the quarantine period will make no further improvement on the infection rate. Every time you lift it, then the wave will happen. So we're now in GCQ. Other cities or other provinces are in MGCQ. How do we move forward? We again looked at some of two specific alternatives. The first alternative that we looked at is to do selective community quarantine. So basically, you just target specific demographics that could go out, just like what the government is actually telling us right now. If you're from 21 to 60, then you can go out. If you're within the high-risk group, you stay at home. Hi. What the graphs show is that you're able to slightly slow down the infection rate, but again, the effect is not as substantial as you would hope for. We look at another alternative, and this what we're doing right now: gradual lifting of community quarantine. So it's like calibrated lifting. Okay, when we say gradual lifting, you gradually relax your rules. Okay, don't go at it all at the same time. This is the assumption that we did with the extension of ECQ. When you lifted, you lift you relax all of the rules. So here we're doing gradual relaxation of rules. Some businesses could open in a staggered fashion. Okay, in this sense, it actually mimics what happens with a strict lockdown, the social distancing that we presented earlier. And we can say that the government is actually doing something right in this area, because here you're now able to significantly reduce the peak and control the spread of your infections. And this is very important when you have a low peak and then the slope of your graph is not that steep. Okay, what you're able to do is to let me go back. What you're able to do is actually you're controlling the spread of the virus, even if the length of the pandemic might still be prolonged, and that's fine. Okay, why is this policy better than the others? So this policy is actually not new, but it just combines the good things about the other policies. It's synergistic in the sense that it takes the good aspects of the other policies and produce complementary results. Okay. So with gradual lifting, you maintain the precautionary measures, but you also allow economic activity to continue. So there will still be infection. We cannot get rid of that, but you control the infection. Okay. So rather than starve the virus and only to have a second wave, I think this shows like ripples instead of waves, and that should be okay, because our healthcare system would be able to manage it. You won't be overloading the capacity, just like what would have happened if we lifted the ECQ prematurely. Okay. So in conclusion, this the study that we did, even if it used hypothetical data, reveals that the most effective strategies focus on avoiding exposure to the virus. That's the best defense, or that's the best recourse that we could do. If you just focus on increasing healthcare capacity, you only delay the inevitable. Eventually, your system will collapse. It's not enough. So the attitude of your population you should be targeting the behavior of your population rather than focus on the resources that you use to battle or to address this virus. And the good thing about system dynamics is that you're able to look at different subsystems of your problem. Okay, that allows you to understand the relationships that exist between the stakeholders, because to address COVID-19, you need to look at the LGU, the local government units, the hospitals, the society, the economy, private and public sectors. So as a final note, COVID-19 has proven to be a complex problem with effects rooted in public health and economics. So they represent important factors in any policy that should be enacted. And this study merely scratches the surface, and there are lots of possible avenues to take, directions to take. And it is critical that deeper analysis and assessment be investigated. And finally, it is important to consider that countries, even those that implemented the same response to the pandemic, have done so with varying degrees of stringency. So they might be labeled as similar policies, but in effect, if you actually vary the stringency, vary the way you implement it, you'll get different set of results. The idea behind this is that, obviously, there's no one solution that could address COVID-19. There is no playbook that we can publish and just follow point by point. Everything still depends on the interaction of your particular system. And with that, I end this presentation and give it back to Kay. Thank you.
Thank you very much, Charlie. That was a very interesting presentation, and I'm sure it has generated a lot of interest in our audience. So let's just begin with some of the questions. So one of the basic fundamental questions comes from Alvin Neil Gutierrez. Hi, Alvin. What differentiates a framework from a model?
Okay, well, basically a framework goes through different steps. It tells you how to actually solve the problem. If it's just a model, then you're just talking about the main, let's say, the main solution technique. But in system dynamics, it's actually comprehensive because it first touches on how you view the problem, okay? How you analyze a problem, what are the important things to note, down to the actual solution. If it's just the model, then you're just looking at the equations that are in play. But system dynamics is telling you it's not enough. You need to take another perspective, and that's systems thinking, right? Yeah.
Okay, thank you. Okay, the next question is comes from Bing Shen Hao, who's from Malaysia. So it seems that it is based on a crucial assumption where the diseases will not mutate. Otherwise, this will not grant immunity to the COVID. So, for example, for this particular situation, is it possible to integrate such assumptions into the model?
Yeah, so that basically, if you do not want to assume that there's immunity, you're just creating another loop. Okay, so that's just another arrow, another like cycle that you have to consider. Yes, that's certainly possible.
Okay, thank you. I'll take one question from the YouTube channel. Actually, there's an ongoing discussion already in the comment section. Anyway, the question comes from Ramil Arshosa. So he's interested about the particular formula in math used in the formulation of system dynamics.
Actually, these equations are differential equations, so it's very similar to what electrical engineers are doing. So yeah, it's based on differential equations, and then you take the first order derivatives.
So does this mean that the model already integrates the delays? So this comes from Angeline Lau.
Yes, so you have the option to do first order delay down to third order delay. So it's really up to the user. Like, for example, if it's information, just the information, you can take a simplistic view and do first order delays. But higher orders are feasible here.
Okay, thank you. We have another question from Bing Shen. So he's wondering if the same model can actually be applied to project the effects of different modes of testing. For example, random testing versus maybe stratified testing, and how it impacts the curves or the behavior.
Yes, in that case, you'll be creating another set of flows. Okay. I think Dr. Colaba showed you earlier that there's a squares and then there are arrows. That if you want to integrate testing, that will require you to create another subsystem because we didn't actually touch on testing. That's one of the limitations of our model.
Okay, great. So maybe in the future work.
Yes, so that's part of the future direction that I was talking about. You can add more subsystems to this. You can make it as complicated as you want. Yes.
Okay, does it have any penalty with regards to how fast the model will solve if you make it more complex?
No. Actually, the good thing about system dynamics is that you solve it. The longest that I've encountered would be like 4 seconds, 3 seconds. It's instantaneous. Okay. It doesn't suffer from the usual NP hard thing of operations research.
Mm-hmm, mm-hmm. Okay, I'll take another question from the YouTube. Can you use system dynamics? This is from Al Serafika. Can you use system dynamics to show the cost-benefit analysis of mass antibody testing?
You can use cost as a performance measure, but that comes after the actual model. So you can actually get you can input cost parameters there, but it's going to be computed afterwards as a performance measure. Yes. So if you want to do cost benefit, yes, certainly. So that means you're testing different policies, and the cost will be instead of like monitoring the effect on infected, you're going to look at the cost. Yes, that's possible.
Okay, thank you, Charlie. So let's take one question maybe from Joel. Seems you have a
All right,
question.
sure.
Yeah.
Thanks, Kathleen. Charlie, thanks for the presentation. 2 quick questions. The first one is, as you know, 2 countries that have been successful thus far, in controlling COVID-19 are Taiwan and South Korea. And that is because of what's been mentioned before. They do extensive testing, but as well as contact tracing. And then, of course, the necessary necessary isolation correspondingly. How would you go about incorporating those in the model that you have?
So again, it's going to be another subsystem, and if you do contact tracing, then you have to assume that you're actually allowing the infection rate to change. Because in our model, one of the limitation was that we assumed a constant infection rate. But if you actually do contact tracing, then you're able to vary this infection rate based on how effective your contact tracing is. So that's another subsystem, yes.
Okay. And the second question I have is, with the current model that you have, how would you go about validating it?
Yes, the only way to validate it is to get actual data, because in system dynamics, what we do is to get a dynamic problem, something that we obtain from literature, and for the baseline scenario, baseline simulation, you want to replicate that reference mode. In the language of SD, we call this the reference mode. And if you're able to replicate that,
do you think at some point you'll be able to access data in the Philippines for you to be able to validate your model?
I think if we want to really validate this, we would probably want another country to look at something, a country that would have a more stable set of data. Because in the Philippines, the problem is there are lots of backlogs, so you can't really rely on the day-to-day reporting.
Right.
But if a country that reports it like consistently, it will be better.
Thanks.
Okay, thank you, Charlie. We have another offline question. So this one comes from Raymond. So thank you for the nice talk. So he has a theoretical question about system dynamics, which is predicated on the construction of a causality map that frames the simulation. Has there been any work on algorithmic or automated generation of such causal networks?
No, because the problem with system dynamics, not really the problem. The theory behind SD is that you're going to apply it to socio-economic problems that would be very complicated, and only someone that would have a good background on the problem could actually dictate the right set of causal relationships. It's not an automated thing that you can just put in the computer. It really lies with the knowledge you have with the relationship between variables, and that's why a lot of time and effort is placed prior to actually building the model. The causal loop diagram represents a huge part of system dynamics. If you don't get that right, then everything else would be flawed eventually.
Okay, thank you, Charlie. We have another question from Vince Daria. So is the model a closed system? So for example, the total number of units are constant. So if not, what is the effect when your system is not closed? And what happens when the system has changed from open to closed to open again? So such scenarios can occur when you stop and open inbound travel, for example.
Actually, system dynamics would have the capability to include exogenous variables and even put changes within the model. There are specific functions that allow you to do that. For example, you first assume that your population is like 100 million without any or like 10 million without any foreigners coming in, and then you can set the model to increase that, like double that to 20 million once foreigners come into your country. So that's possible. You introduce an external variable in the middle of the simulation. That's something that the model is capable of handling.
Okay, great. I'll take another comment from the YouTube channel. So this one's from Angeline Lau. So it looks like the delay is part of the model. Is it possible to modify the model such that some are assumed to have delay while others don't? And then a follow-up question is there a reason why the peaks of the plots are narrow?
Yes, again, the delay is something that you can inject. Okay, like for example, I'll use a business example. Like in a supply chain, when you try to deliver something, there's a lead time between ordering and delivery. So that is something that the model can handle. Now, with regards to the steepness of the peaks, that just represents the exponential increase in infections. So again, because in our case, we assume that the infection rate is constant. But if you're able to do something, if your policy actually targets the reduction of infection rate, then you'll be able to change the slope of these peaks. And that's why we had some policies that had a wider spread of infections.
Okay, so one question from Edsel Peña. Okay, hold on. Let me just. Uh, okay, is it the case that the models that are being considered are deterministic but still dynamic? Wouldn't it be more realistic to model this using stochastic ones, such as continuous time Markov chains? There's
So
a follow up, sorry. Also, in the models, there are many parameters. How do you actually estimate those parameters in a real situation, such as a pandemic?
yes, so actually, it's a counterintuitive in system dynamics. We prefer to use during your baseline. It's better to use deterministic values because that allows you to actually monitor the dynamic behavior of the variables. If you introduce distributions at the start, then the behavior might actually just follow the random behavior of your parameters. But if you really want to include like probability distributions, the model could handle it. But again, this runs the risk of confounding, okay, confounding the actual behavior of your system. Because the premise behind SD is that you don't need a lot of confusing data. Let the system dictate the behavior, because the interactions uh, will actually drive the peaks and the trough and the increase and the decrease through time, the waves that will all be produced by the natural dynamics present in your system.
Okay, another one from Angeline Lau. So, in system dynamics, do you also perform model fitting to obtain the parameters of the model?
Oh, I forgot to answer the first the follow-up question regarding parameters. No, as mentioned, the first prior to actually building the model, that is where the actual work comes in. If in our experience in SD, a lot of the parameters really takes a lot of time to research on, because we look at all of the literature. Each relationship should be supported by literature. It's not enough to assume that they're directly proportional. We really look at the degree of the relationship. Is it like times 10? Is it will susceptible to infection would be like 0.5? We don't know. So the infection rate, these rates should be supported by literature. Yes. Like the other question by
Yeah,
Angeli.
yeah, the one from Angie. If you do fitting, model fitting as well to
Yes, so that
identify the
that will
parameters.
all come prior to actually building. When you try to finalize your parameters, you need to back it up with with data based from literature, from actual events, so that you'll prevent the garbage in garbage out that is
Mhm.
often stated in models.
Okay, thank you. We have another question from Ms. Heidi Balsera. Have you considered raising these models to government agencies such as the IATF for better policy development, or even the UP Pandemic Response Team, since she believes that they are also working on similar related models? Perhaps a collaboration in the scientific community is essential during these times.
Actually, our during this ECQ, from the start of the ECQ, a lot of the team members have been talking to different institutions, and we have ongoing projects that are composed by faculty members, researchers coming from different institutions that actually share results. So, but in terms of raising this to the IATF, we haven't yet done that, unfortunately.
Yeah, maybe we should ask our institutes also,
Oh,
like si Ador, for example, who's involved in the Robredo Institute. He's very much, I think, linked with the LGUs also. Okay, another one on the YouTube channel from Ramil Arshosa. What about education, economy, healthcare, government? The most important tool in this pandemic. How is it considered, for example, in this model?
okay. Unfortunately, we haven't touched upon the education sector. Again, we this was done like at the start of the ECQ, and we just wanted to we were limited by the things that we can consider. But education was touched upon by our social distancing policies, because for us that's the best way to actually drive the message across. So there was one subsystem on education, but not as significant as should have been done. Yeah, one of the limitations.
Yeah, and I think it will be something of interest later on, especially now that the education has been
Yeah, because
disrupted and
when we did this, the concerns about homeschooling, that wasn't really highlighted yet.
the main, yeah,
Yeah,
it
yeah,
wasn't the
that was not the main concern at that moment.
Okay, we have another one from Edsel. In the example of this current pandemic, there is no prior data. So wouldn't you need to also estimate the parameters dynamically? That is, as data accrues, that's how you generate the parameters. So you
Yes,
need to update your estimates of the parameters, such as the R naught, for example.
yes. Again, we used hypothetical data here. We were hinging on the natural behavior of viruses, but definitely, if we want to extend this in the future, the next step would be doing actual data. So that requires
Mhm.
working closely with the LGU and the government units that actually would have access to the data that we need.
Okay, another one from Angeline Lau. Have you tried integrating optimal control approach into the SD models?
I did it as part of my dissertation, but not for this study. So in during my dissertation, the concern, because SD is often targeted as being a soft modeling framework. So what I did during my dissertation was to actually try to optimize the parameter. Like for example, uh, if you want to implement lockdowns, how long
Mhm.
specifically should be the lockdown? So we did that before, and that requires you to step out of SD and do more control methodologies like the ones you do in electrical engineering. So target the differential equations.
Okay. We have one more from Bingshan Hao. So, in view of the data availability limitation, do you think data from other countries can be used to effectively predict the effect on one country?
Yes, because again, SD just maps out the relationship. If you feel that the dynamic is actually the same, then you can just plug in any set of parameters that you want. But provided again that the dynamics are the same, so the relationship, the causality remains intact. But if something is not the same, then you can just change how that particular subsystem is modeled. But
Okay.
yes,
So maybe just a follow up on that. So, for example, if you wanted to model Italy versus the Philippines, what would be the differences, like in terms of in the model, like what would you integrate to represent Italy more or to represent the characteristics of the Philippines?
I think we can say about the implementation here, because in the ECQ, in the lockdown that we did, we still allowed people to actually go out, just like what we experienced. But in Italy, it was totally different. And you can see that from the graph earlier regarding the lockdown, because in their case, everyone is really forced to stay at home. So yeah, so that might change. So maybe just tweaking like some of the parameters, but in that case, the dynamic behavior should remain the same. Yeah.
Okay, I think I've exhausted all the questions, both here on the chat and on the YouTube. Charlie, can you share with us the slides as well so that I can send a copy to the
Okay,
participants?
I'll email it to you.
Okay, and then can the people contact you if they want further information?
Yes, I think we'll provide our contact details in the slides.
Okay, do you have any other final words or maybe see Dr. Colaba?
Yeah,
Dr.
maybe
Colaba, do you
Dr.
have any?
Kalaba can take the final.
Yeah, Dr. Colaba, any additional comments before we end the session? Okay, maybe he stepped out a bit. Okay. While we're waiting, maybe I'll just plug first our next event. Okay. Okay, I do hope that everyone can see my screen right now. So for next week, we will be having Dr. Joel Coelho and Ralph Becker. So Dr. Joel Coelho is currently the professor of biosystems engineering at the University of Arizona, while Ralph Becker is the founder and CAO of Urban Greens Philippines. So next week, we'll learn about lessons from COVID-19, re-engineering the food supply chain in the US, and vertical farming for urban resilience in the Philippines. So we'll be on the same time, Friday, June 12, 8 o'clock in the morning for those in the Philippines. To register, so please go to bit.ly /Joel Coelho. And then, okay, hold on. Okay, so this is also an announcement that was sent to me. So for those who are interested for the Climate Launchpad, so this is like a competition. So it's a climate-focused startup incubator and competition. So they are now accepting applications. Deadline for applications will be on June 14. So for those who want further details, please go to climatelaunchpad.org or have a look at their application in the link that I've provided there. So the Philippine American Academy of Science and Engineering, you can find us on Facebook. And we also have our own website, which is paase.org. And all the webinars that we're conducting every Friday will be uploaded in our YouTube channel, Paase Webinars, which you can find at bit.ly /Paase Webinars. So Dr. Kulaba, before we end, do you have any final words for our audience?
Well, thank you very much for taking your time. I know this is an interesting time for everyone. So we welcome any possible collaboration on the works to address the COVID-19 pandemic. So once again, stay safe and healthy and happy, everyone. Thank you and good morning and good evening to other parts of the world. Thank you, Kate. Thank you, Charlie.
Thank you, everyone. Thank you, Charlie. Thank you, Dr.
Thank you,
Kulaba.
everyone.
Thank you to our
Thank you.
audience. Hope I'll see you again next week.
Thank you.
Okay.
Bye.
Bye-bye.
Bye.
Bye.